Without services and without housing, secure housing, I might not be sitting here today. I don't know where I would be.
You got some poor soul out there walking around and doesn't have anybody or nowhere to go.
I know I wouldn't be able to do an apartment on my own without help. It would be a lot more stressful, and it'd be a lot different if I didn't have those services.
Without BH Care, I probably would, I don't know. I'd probably be lost.
I think I wouldn't be alive if it wasn't for Bernadette and the CHR program.
I know if I didn't have them here, I would be, probably under a bridge or in a gutter somewhere.
I would be on drugs. I would be in and out of the hospital.
Probably dead. Yeah.
When we feel that we're not being listened to, then that's hope lost right there. Here, I've never felt that with anybody that works here.
The people we serve are dying 25 years earlier than the rest of the population. And the services that we provide help give support and help people find their recovery, their health, whatever that's going to look like.
LMHA is a local mental health authority. It is funded by Department of Mental Health and Addiction Services to help us provide the best services possible for our population.
Local mental health authorities are designed to be the locus of coordination of care for individuals who need mental health and increasingly substance abuse services in a particular area.
We use the biopsychosocial approach. Biological meaning medical, psychological, which is the mental health, and the social issues that our clients encounter, including housing, employment, family issues, and even education.
Most LMHAs offer everything from crisis response to outpatient treatment, and then the supportive services such as case management, social rehabilitation, employment services, behavioral health homes, and all of that is under one roof.
The best part of us, we don't turn anybody away. Our programs just aren't in the building. Our programs are within the community. We have the availability to be able to go out and meet with the clients where they're at.
As an LMHA, we are best equipped to provide the services for the patients that come to us. Other providers, other clinics are not equipped to do so in the same way, as we are really seeing patients that have severe and persistent mental illness. They need a full array of services.
We're not talking about someone who just struggles with depression every now and again. We're talking about someone who's had schizophrenia for 20 years, further complicated by diabetes, further complicated by history of cancer. People like that likely end up homeless and sick, which is, far worse than just not being housed.
We're really the safety net of the state. We're the ones who are really making sure that people are not falling through the cracks, that people are not dying, that people are having their best life.
When other folks, family, friends have shut the door, have washed their hands of these individuals, we're there. We become their family.
The importance in funding LMHAs is in order to reduce the costs of acute care beds, hospital stays of the clients that we serve, prisons. Overall, it's just much more cost-effective for us to have the funding in order to properly treat and care for those dealing with chronic mental illness and co-occurring substance use disorders in order to avoid those higher costs.
We've seen patients that have great success, huge success stories, but it comes with the ongoing funding to provide the services that help the patients to get to that level of functioning in their own lives that have really made them successful.
We are dependent upon state budget and funding allocations, and in the last recent years, Those have been very limited or non-existent. We haven't gotten them at all. And despite those limitations in funding, we've continued to get requests for more services.
Our community support services are stretched thin right now. We need more workers. We need to be able to hire more workers.
Our communities keep changing and they keep growing, and we need to be able to keep up with that. If we're not able to, then we're doing a disservice.
Everyone deserves to live the best kind of life that they can. And without the support of an LMHA, our clients are not going to get what they deserve.
The support I have received has helped me become a better person, become more independent.
You're encouraged to take charge of your own life. It's not just like a handout, it's a hand up.
It's a safe place to come to, and they do help you. They really do. Because I was in a shelter, and coming here helped me get out of the shelter, helped me get out of everything, helped me get where I am today.
I'm off the streets. I have my own place. I pay rent. I feel great.
I want to get my GED, and I want to be a peer specialist.
I just want to thrive and be the best person I can to help other people.
Keep this place open for a long, long time.
Coming here, I'm now a productive member of society. I'm on several boards and commissions in town.
For the first time in my life, I'm happy. I'm genuinely happy. And I don't want to change that.
They pull us out of the darkness and into the light and make us feel home.
This place saved my life.